guys, good morning. Today I am talking about with what to do in case of contracting respiratory diseases. Prevention to strict healthcare for people with chronic respiratory diseases by identifying cost-effective interventions, approving criteria, and access to healthcare at all levels of the healthcare system. And the first is for the prevention of chronic respiratory diseases and to introduce individual to the topics to prevent and reduce the rate of morbidity, disability, and premature death due to chronic respiratory diseases and especially asthma and chronic obstructive pulmonary disease. So, also for one, better monitoring of the magnitude of chronic respiratory diseases and analysis of their determining factor, especially on poor and disadvantaged population control of future trends. Help prevent all kinds of diseases that can become an epidemic or pandemic, such as the coronavirus, for example, which is currently in the world and is being quarantined for the entire population. The causes, the most important risk factor for respiratory diseases are the following: smoke, indoor air population, for example, passive exposed to tobacco smoke, environment population, exposure to allergies, and inhalation of the dust and chemicals and the workplace. How is it presented? Persistent cough, shortness of breath, dyspnea, and respiratory secretions are the most frequent symptoms, the intensity of which varies from person to person. According to the diseases in question, its degree of severity and time of evolution. The prevention wash your hand regularly. This is especially important after touching surface of or objects that may contaminate with respiratory droplets from sick people or after touching people with system of respiratory condition. Alcohol-based hands health are a suitable substitute when soap and clean water are not available. Respiratory diseases affect many people in many ways, either when breathing or throat, the skin, or with external symptoms such as a fever, cold, or weight loss. Um, that is why we must lead a healthier life, and if it were a chronic disease, consult your doctor and take adequate treatment. Okay? See you later.